Hi there, it's Adrian Baker, nurse practitioner at Lumia MediSpa. Today I wanted to talk to you about the risks of Botox or botulinum neurotoxin, which is often used for lines and wrinkles on the face. Now, what I don't want you to take away from this is not a consultation, but I want to explain to you some of the side effects or the potential risks of that treatment. But please do always consult with a medical professional who has experience in aesthetics and allow them to explain the risks to you if you are wanting to undertake a treatment. So what are the risks and benefits of botulinum neurotoxin? Most risks generally, and the most common likely things to happen would be injection related. So it is administered with a small needle. So you could develop a small bruise or sometimes even a big bruise. So it's really important that you consider if you've got any social engagements that you could potentially have a bruise that could last a few weeks. So always please bear that in mind. You'll also have some little bumps under the skin that'll be there just for a couple of hours, and that's actually the liquid medication where it's being delivered. So again, any kind of plans you might have straight after treatment, just bear that in mind that you may have some little bumps. Aside from those kind of procedural risks, botulinum neurotoxin is a prescription-only medication, and it does come with some serious side effects. Often I'll explain to my patients that they might get a bit of a headache after the treatment, and that might be straight away after the procedure, and that's because we've injected into the muscles and they can become a little bit tense after that, and so it can create a bit of a tension headache. However, it might be a few days later. So as the botulinum toxin is taking effect, the muscles are relaxing and other muscles then start to join in and become tense to kind of help those muscles out. And it can create a bit of a headache, like a tension, for a couple of days. It's usually nothing to worry about, but please do reach out if you feel worried or concerned about it. And you usually can just take what you would normally take for a headache. Another side effect that can occur, and this is probably the one that most people are worried or scared about or have read about before, and that's an eyelid ptosis, or a droopy eyelid or a droopy eyebrow. And this is caused by the medication that was injected actually having an effect on a muscle that it wasn't intended to work on. So it may have traveled ever so slightly or diffused differently, and then it has its effect there. And so it could cause the eyelid muscle instead to drop forward and not be able to pick up and open correctly. Now, if this happens, there usually isn't a huge amount that we can do, which is probably why people get so worried about it. I'd like to reassure you that it is something that is very rare to happen, but we are also here. If it does, we would want you to reach out and contact us. There are a few prescription drops that we can give you that help to stimulate a different muscle at the back of the eye called the Muller's muscle, and it allows the eyelid to just open and help you look a little bit more normal until it has resolved. But it's important to know it could occur for a couple of weeks, or it could last sort of 3 or 4 months even. So this is really important for you to consider. So if you obviously need your vision for your job, so if you are driving a lorry or a bus or something like that, or you really do depend on your appearance for your career, this is going to be an important thing for you to consider. Although it's very rare to happen, if it did, what would you do? So please do always consider your lifestyle and how these risks would affect you if they were to occur. It's also important for you to consider that you might not like the effect, or you might not like the result, or it could cause some asymmetry. So one eyebrow might go up a little bit, or it may come down a little bit. So these are normally things that we can resolve in the clinic at your review, which is normally sort of 14 to 21 days later. But it's important that these treatments are for a duration of time, and so if you don't like the effect, you're going to be left with it for maybe 3 or 4 months. So please do always bear that in mind as well. I hope that's been helpful for you. If you do ever want to have a consultation with us, please do get in touch with us over the phone or book online for an aesthetic nurse consultation, and where we will then really discuss all of the risks and benefits in much greater detail. But I hope that's helpful in the meantime to provide some balance to the benefits that are being posted out there a lot. This helps you just to balance that with the risk profile. All right, take care.